We described the common mechanisms of bacterial resistance and mechanism of action of beta-lactams. We recommended effective drug therapy for the treatment of bacteremia, and we changed empiric therapy to pathogen-directed therapy based on blood culture and susceptibility results. Now, let's select total duration of therapy for bacteremia based on causative organism. Here are some general principles for management of bacteremia. So it is important to repeat blood cultures every 1 to 2 days, so every 24 to 48 hours after a positive blood cultures until there is a negative culture. And in general, the very first blood culture that's available, that would be considered day 1 of therapy. And that is because that's when we confirm that the source of infection has been controlled. Because for many of these bacteremia where the source of infection is not controlled, blood cultures continue to be positive for many days. So as long as the source of infection is not controlled, any antibiotics that has been used has not really been able to eradicate the infection. Now for uncomplicated gram-negative bacteremia, a total of 7 days is appropriate. Specifically in patients who have achieved source control, are afebrile for at least 48 hours, and are hemodynamically stable. Especially if the source of bacteremia is from the urine caused by Enterobacterales. Otherwise, a longer duration of therapy of 14 days may be needed based on clinical judgment, especially for non-fermenting gram-negative organisms such as Pseudomonas and Acinetobacter. Now, it's important to note that there are no clinical practice guidelines for gram-negative bacteremia. So you may see that at different places, practice might be different. For MRSA specifically, there is an IDSA guideline that was published in 2011. And it recommends that for adults with uncomplicated MRSA, vancomycin or daptomycin for at least 2 weeks is recommended. And the definition of uncomplicated MRSA bacteremia is someone who does not have endocarditis, there are no implanted prostheses, so no hardware, follow-up blood culture performed on specimen obtained 2 to 4 days after the initial set that do not grow MRSA, so there should be a negative culture within 2 to 4 days, and defervescence within 72 hours of initiating effective therapy. And defervescence basically means resolution of fever within 72 hours. And there should be no evidence of metastatic site of infection. In other words, the infection should not be going from the blood to other organs or any other site. If the patient meets all of these criteria, the bacteremia will be considered uncomplicated. Otherwise, if the answer to any of these is a yes, then the patient has complicated MRSA bacteremia, and then the duration of treatment is 4 to 6 weeks, so at least 4 weeks. And then the way, whether it should be 4 weeks, 5 weeks, or 6 weeks depends on how the patient responds during the first 4 weeks and based on the clinical judgment of the clinicians. This concludes this presentation.